Hello, and welcome to the Responsible Gambling Council's webinar on youth gambling. My name is Lisa Couperus, and I'm the Associate Director of Education and Programs, and I'm pleased to be here with my colleague, Dr. Jennifer Reynolds, the Associate Director of Research and Knowledge Mobilization. We want to thank you all for joining us, whether you're an educator, public health professional, community organization member, representing government or an operator, or part of a youth serving agency. We're glad you're joining us today. The session is going to explore key insights into youth gambling and associated risk behaviors. We'll highlight educational and harm prevention opportunities and share practical recommendations to help strengthen youth-focused supports across the sector. Our goal today is to build capacity, inform practice, and spark meaningful change in youth gambling prevention and digital well-being. We hope you'll be inspired to take what you learned today back to your own communities and organizations. We do want to begin today by acknowledging the Indigenous peoples of the lands that we're on. The Responsible Gambling Council was founded on the traditional lands of the Mississaugas of the Credit, Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples. This land continues to be home to diverse Indigenous peoples whom we recognize as contemporary stewards of the land. And from coast to coast, RGC shows their respect for and pays homage to the Indigenous community. We acknowledge the ancestral and unceded territory of all Inuit, Métis, and First Nations people that call this land home. RGC recognizes the importance of the lands, reaffirms our commitment and our responsibility to improving our understanding of Indigenous peoples and their cultures. And today we present from a place of gratitude for the opportunity to share knowledge and to inform and improve educational programs that are rooted in community needs, experiences, and perspectives. The webinar content will begin today with a brief overview of RGC and the rationale for our youth research project. Following this, we're going to ask Jennifer to take us through the recent research initiatives, the key findings and strategic recommendations. Next, we're going to share how RGC is using the findings. We'll respond to questions and request your feedback to the webinar today. We have received a few questions already through the registration process, and we're also going to ask attendees to drop questions into the chat box. Please don't use the Q&A function, but actually the chat box, and Jennifer and I will try to answer as many as the time allows. In terms of housekeeping, we wanted to let you know that there won't be any continuing education units being offered as part of today's session. And lastly, after today's webinar is complete and within the next few days, we'll be circulating a recording of the session along with the Understanding Youth Gambling Building Safer Communities report for your review and your use. So we do know that today there's some people in the session who are new to the Responsible Gambling Council. So we do want to take a brief minute to talk a little bit about ourselves. We are an independent nonprofit organization. We were founded in 1983. So RGC has more than 40 years experience working in this space. We have been recognized globally for our leadership in the areas of prevention education, in research, accreditation, training, and policy guidance. For more than 20 years, RGC has benefited from the Ontario Ministry of Health support, which has allowed us to create evidence-informed targeted messages for high school and post-secondary students. This funding has enabled us to make youth and young adults a priority focus and to offer harm prevention awareness programs and training to schools and community organizations at no cost. RGC has been in the classroom and on campuses partnering with educators since the 2001-02 academic school year. Our objective is to create and deliver engaging and age-appropriate programs that increase the knowledge and understanding of gambling risks and myths, signs of harm, and available supports. RGC Youth Education is designed to connect authentically with these audiences using visuals, mediums, and language that's relevant and engaging for the target demographic and are based on the latest research and insights that reflect the ever-changing landscape. In response to rapid technological advancements, changes in the gambling environment, and the increasing amount of time spent online by young people, our programs have continued to adapt to address digital convergence, the risks of underage gambling and of gambling-like elements in video games, and general health and well-being. In 2024-25, RGC, with the support of the Ontario Ministry of Health, worked with the Research Strategy Group to undertake a youth research project made up of 4 key components that Jennifer will take you through very shortly. This important project allowed not only RGC to better understand the prevention needs of young people, but allowed us to share these insights and recommendations with our partners, other educators, and stakeholders to increase capacity and inform future programming. I'll now pass things over to Jennifer, who will guide us through the key insights and strategic recommendations from the research project.
Okay, hello. Thank you, Lisa. And hello, everyone out there. So as she was saying, this past year, the preventions team undertook 4 different initiatives. There was a lit review, stakeholder engagement interviews, youth digital diaries, and a youth survey that went out. The literature was a rapid search of existing literature focusing on gambling, recent trends, mental health, and technology. The stakeholder mapping and survey, in total, we had 42 stakeholders participate from various sectors, including mental health services, addiction, prevention, education, government agencies, and community groups. We then did digital diaries. In total, there were 22 Ontario youth, and this was from ages 12 to 24, participating in a 3-day online digital diary with interactive exercises. And then finally, there was the youth survey. It was 1,000 Ontario youth ages 12 to 25 that participated in this survey. Today's young people are growing up gambling, they're surrounded by gambling, and participating in gambling before they're legally able to do so. Youth research is recognized as a public health concern. Recent research indicates that North American youth have the highest adolescent gambling rates globally at 33%. In Ontario, almost 21% of adolescents have reported gambling at some time in their lives. Males are more significantly more likely to gamble than females. Youth described gambling long before the legal age, often through different ways of language, games, playful wagers that blur the line between fun and betting. For example, in the language, we often hear the words, "I bet you." It's widely used to express confidence and dares. Sometimes it becomes an actual bet, sometimes not. We have games where gambling-like features are present in video games. We have peer play, where youth also simulate gambling through low-stake activities, such as playing poker for candy and cards. These experiences ultimately show how gambling culture and terminology have become normalized early on, creating familiarity and comfort with low risk or risk-based play. Youth are particularly vulnerable to gambling-related harms. Youth exposure to gambling is increasing rapidly through digital platforms, especially gaming and social media. We know that our brains aren't fully developed until the age of 25. The prefrontal cortex governs functions such as planning, impulse control, decision-making. And essentially, we have the blurring of gambling and gaming. This can be seen in social casino games. And these games are designed to encourage players to use real money within the game. We also have ubiquitous marketing and advertising, leading to that normalization of gambling. And for young adults in particular, this time of life leaves them increased risk for a number of reasons. First, they're able to legally gamble. and along with that neurological development, there's a lot of illusions of control, that the cognitive biases that play in. There's social pressures around peer groups, especially online. And when they see people that are gambling, it makes them feel like they need to sort of participate. There's mental health concerns. We are now seeing a lot of research that's really specialized, looking at those mental health concerns for this age demographic. But also it's their first living experience independently. So they're living on their own. They may have incomes. So it just kind of puts them in a little bit of different risk factors. Just going to go now into the study findings looking around youth and perception of behaviors. We continue to see that youth differentiate activities of gambling versus betting. Sometimes they think of it as both, sometimes neither. And so this chart really illustrates the top 5 activities broken down into how youth classified the activities. Traditional activities, gambling activities, are more likely to be considered gambling, where activities that involve wagering or sports were more likely to be viewed as betting. We then asked young people about the popularity of gambling among people their age. Most youth gambled or bet as popular among their, or report that youth gambling is popular among their peers, but perceptions increase sharply with age. While around 7 and 10 younger teens, that 12 to 17 age, see it as popular, this climbs to 9 out of 10 in that older demographic of 18 to 24. So this pattern really reflects greater exposure and normalization of gambling in older ages, especially as they gain that legal access and see it more within their circles, their peers and social circles. Nearly half of youth aged 12 to 24 report having gambled at least once. Participation rises steadily with age from 36% among that 12 to 24 age group to 65% among that 12 or 21 to 24. We found that males are more significantly likely to gamble at 50% compared to females, which were 38%. We then asked the top motivations for youth to agree to about why they gamble, and so the top ones that we found were youth are gambling as a way to win money, because it's fun, to socialize with friends, and because they like the feeling of taking risks. Other motivations have lower agreement, but are still on the higher end and with over half agreeing. When we looked females versus males, males were more likely to agree with to win money and because it's fun, where females were more likely to agree with socializing with friends. We asked if they have been affected by someone else's gambling. While most youth, 83% report no personal problems caused by another person's gambling, 17%, and that's about 1 in 6, say that they have been affected. This proportion is relatively high and reinforces that the harms of gambling extend beyond the gambler, impacting peers, friends, family members. And we found that rates are slightly higher among that older youth, that 18 to 24, reflecting that greater exposure to gambling within their social circles. And they might have been able to really start recognizing those gambling related harms. I'm going to flip over now to parental influences. So we found that almost half of the youth who have gambled reported doing so with their parents' approval. This approval rate was highest among that 12 to 17 age and around 40 to 50%, showing that many gambling experiences are occurring with a permissive family context. So in contrast, that rate drops among that 18 to 24, and that's around 32 to 34%. And this is probably likely because they're legally able to gamble. They can gamble independently without needing those permissions. But this pattern also points to a normalization with gambling within families, where parents may unintentionally endorse or participating in betting activities with their children. And so these findings really underscore the importance of early education for both parents and youth about the risks of gambling and how parent modeling influences attitudes. These youth quotes illustrate that gambling is sometimes normalized or even facilitated by adults, some suggesting that early gambling exposure and normalization again. Youth report engaging in online or in-person sports betting with that parental involvement. In many cases, parents actively encouraged or participated in the behavior. And we found that one third of youth have never discussed gambling with their parents, and that parental messages range from that cautionary of be responsible to that permissive, it's fine in moderation sort of messaging. I'm going to switch now into harm prevention or harm minimization and prevention programming. Gambling advertising and marketing is ubiquitous. Youth consistently describe gambling advertisements as unavoidable and irritating, especially in that social media and sports platforms. Many interpret them as only showing how easy it is to win money. Participants also highlighted the lack of balance between promotional and responsible messaging. So overall, the perception is that youth ads dominate the media space, while responsible gambling content is minimal, may be ineffective, creating frustration and distrust towards the industry. We found that 19%, and that's 1 in 5 roughly, of youth report overall participating in school-based gambling prevention programs, and this is across the last 6 months. Engagement is steady at that 20% for that 12 to 17 age, but falls to 15 to 18% among that 18 to 24-year-olds. So this shows that school programs mainly reach younger students with limited exposure after high school, indicates a gap in prevention access for older youth, especially for those that are outside of the school settings. So we have this slide indicates these campaigns have meaningful impact, but should be better tailored to fit to those older teens and young adults. We have 46% of youth, almost half, exposed to prevention media, say that it influenced their gambling or betting behavior. Influence is steady at that 12 to 17 at 45%, but it dips to 37% for that 18 to 20, and then rises again to 53% at that 21 to 24 age group. So this really suggests lower receptiveness in late adolescence, followed by greater reflection as they're getting older. We know that gambling and gaming is continuing to converge. And we know that youth participating in gaming is high. So we really wanted to get an understanding of how youth were playing video games. So this slide illustrates that gaming is a regular part of most young people's routines, particularly during early adolescence and mid-adolescence. So we have that 1/3 of them are playing games daily. 31% of people who play video games report doing so daily, with another 27% playing that 4 to 6 days a week. When we look at that youth 18 to 20, we show it's the lowest daily play rate at 19%, while younger groups in that 12 to 17 age groups are more frequent players. This really indicates that video game playing is quite common across all age groups, but we also found that it's quite common, equally distributed between males and females. We also wanted to look at in-game spending, and we found that it's actually quite widespread among youth. We have high engagement with in-game spending. It suggests familiarity with monetary risk and reward systems, which are common in gambling. 62% of youth gamers report spending money within games, and that rate rises to 60% at that 12 to 17 to 71% at that 21 to 24. And we found that men were more likely to spend money in video games. However, the majority of both groups have done in-game purchases. We wanted to look at what they were spending their money on. So this spending focuses on really those cosmetic and reward features, reflecting both personalization and progression motives common in gaming. The most purchased items were skins, and that's at 52%. In-game currency or chips were 49%, and that specific avatar items were 45%. Older adults, 18 to 24, spend less on the avatar items or level gains, but maintain interest in those loot boxes, and that was around 30%. We found that men were slightly more likely on most features, especially the cosmetic and currency items. But we found that spending patterns are similar across genders for those progression-related features, so getting more further ahead within the game. Next, we wanted to really look at sort of well-being. So we asked youth a bunch of questions. So we know that mental health is an important aspect to really understand, particularly when we take a more holistic approach to gambling harm prevention programming. We see that reported happiness declines with age, aligning with observed increases in stress and life challenges, which I'll kind of show you at the next slide. But this slide, we have 78% of youth overall describe themselves as happy, and that's sort of very and pretty happy. This raises to 83% when we're looking at that 12 to 17-year-olds, but then falls to 56% for ages 18 to 20, and then rises slightly again for that 66% for that 24%. So younger adolescents maintain high levels of self-reported happiness, while older youth show a clear downward shift, likely reflecting those growing responsibilities and transitional pressures. When we looked to see if there's any gender differences, well, both genders report feeling pretty happy. Men are nearly twice as likely to say they were very happy compared to females. We looked again at that perceived stress. We found that stress levels appear to increase with age, possibly reflecting that growing academic, social, financial pressures as they age. So overall, the youth overall, when we looked at, was 24% report that most of their days were stressful. This was lowest when we broke it down to that 12 to 24-year-old age group, which was 19%, and then rose to that 18 to 20% to 37, and then drop down to that 30% for that 21 to 24. The next part we looked at was we did a stakeholder survey and mapping with 42 stakeholders across various sectors. Several gaps were identified. 63% observed gambling concerns among youth. Only 47% run gambling-specific initiatives, and overall 77% lack adequate resources, where 55% lack dedicated funding. The research highlights that current prevention efforts are fragmented and underfunded, limiting national impact. There is a clear need for programs specifically on gambling, not just general addiction and awareness. School and youth programs are ideal channels for early prevention messaging. Expanding training, funding access, and parent-focused education will make prevention more sustainable and reach more at-risk youth. So all of that information was basically brought together, and all the findings were put together to create a bunch of strategic recommendations moving forward. So of all, education and early prevention was really targeted the first. We want to suggest developing school-based programming to help youth understand gambling and related harms, improve financial literacy, mathematical reasoning, and really recognizing those psychological tactics used in gambling marketing. It's really suggesting a holistic approach which equips youth to identify gambling risks and understand how gambling increasingly intersects with youth gaming and online environments. So next was looking at targeted outreach, or suggesting targeted outreach, really prioritizing interventions with youth who face elevated risk of gambling-related harm, and that's including Indigenous and racialized youth, males, and those with low-income communities. And it's about collaborating with community organizations to develop culturally responsive prevention programming that reflects the lived experiences, values, and needs of those populations. We also want to suggest recommend parental and community engagement. And this is really supporting parents, caregivers, teachers, coaches, community leaders by offering education programs that raise awareness of youth gambling risks and harms, and really encouraging open conversations within families about gambling, financial responsibility, and those healthy media habits to try and strengthen community capacity and providing accessible resources and training to help trusted adults recognize and respond to gambling-related harms among youth. The fourth one is stakeholder perspectives. So this is really about strengthening partnerships with mental health, education, and addiction prevention organizations. It's these strategic collaborations will leverage the expertise of stakeholders to develop innovative, evidence-based resources that address the evolving risk of youth gambling. The next one is really the youth perception behaviors. So integrating gambling prevention into broader mental health and substance use initiatives, emphasizing resilience building and healthy coping strategies that support youth across physical, mental, social, and environmental dimensions. And the last one is around monitoring and research. So this is gambling prevention programs must continuously evolve to reflect the latest research and emerging trends. This ensures that programs remain effective, responsive to new areas of concern, and informed by the growing body of evidence on the connection between gambling, mental health, and video gaming. Regular updates also support a deeper understanding of program impact and help identify opportunities for improvement in the future. Over to you, Lisa.
Thank you so much, Jennifer. The findings that were shared and really importantly, the strategic recommendations, they're actively being implemented across our work now and in our future planning. There's 3 initiatives underway that I want to share with you today. First is we're thrilled to announce that RGC has partnered with GRIO Evidence Insights, which is an independent nonprofit organization specializing in research, knowledge mobilization, and evaluation in the health and well-being sectors. And they'll help to develop a youth education and prevention framework that will shape how young people learn about gambling risks and how they access supports. This collaboration, which is focused on preventing gambling harm, will take a 3-stage approach targeting grades 11 and 12 students, then we'll expand to grades 9, 10, and ultimately reaching elementary age students. Our consultations are going to engage with students directly, but also with parents of underage youth and people in positions of authority that include teachers and coaches across all 3 target demographics. This strategy will be impactful, it will be innovative, and set the standard rooted in evidence and supported by voices of youth and communities. In support of the strategic recommendation on education and early prevention, RGC is launching Beyond the Game, a grades 11 and 12 training program with an accompanying facilitator guide for coaches. This approximately 30-minute training module is focusing on the unique and high-risk student athlete, and it contains animated scenarios, interactive Q&A designed to increase their knowledge and understanding of gambling risks, impacts, supports, and healthy decision-making. Ontario secondary schools will be able to download this free module in PowerPoint and Google Slide formats from rgc.org in a few weeks' time, with expansion to other provinces to follow. Now, through the parental and community engagement recommendation Jennifer touched on, RGC is currently developing a new campaign that supports parents and caregivers of high school students, particularly those aged 15 to 17, who are at risk of underage gambling. Our secondary priority audience for this strategy is teachers, coaches, and other people in positions of authority. The focus will be on increasing their knowledge on the newer forms of gambling, including sports betting, recognizing signs of harm, understanding the unique risks associated with underage gambling, and also providing guidance on how to start conversations with their child about the topic. To support this, we're going to be launching a new parent caregiver section on the RGC website, along with a digital campaign directing people to more information. So as we wrap up today's presentation, we'd like to leave you with 3 key action items to consider in your own work. We would encourage you to actively reach out to and include the voices and perspectives of young people in the work that you're doing. Their ideas and their experiences will contribute greatly to our understanding and the programming. Whether you're a parent, an educator, or someone in a position to affect positive change, promote and encourage discussions and learning opportunities to understand and increase knowledge about youth gambling and its related harms. And no matter where you are in your own understanding on youth gambling, look to other organizations who work in the treatment or addiction space, in mental health or on substance use, or across education, and explore opportunities to work together. On that note, we do want to invite you to join our Youth Research Hub by scanning the on-screen QR code. We will be inviting organizations to connect with RGC and GRIO on its youth strategy development by participating in our focus groups or sharing insights learned from your own practice. We'll also use this resource hub as a way to keep interested organizations and people up to date on our future educational opportunities and our new programs. And so now we'll stop the presentation for a moment and move into any questions that have come through. So I think we're just getting some sent to us now. I know that we had received one that had come through the registration that a gambling operator had asked us about how to best utilize the information that we're providing to educate their casino staff. So I'll start with this one is just speaking about the fact that access to land-based gambling venues for underage youth is virtually non-existent. So what we do know is that young people are spending a lot of time, a lot of hours playing video games, which have gambling-like elements embedded in them. They play a lot of social casino games, and underage youth are pretty good at figuring out how to get around online age restrictions. And so we know underage youth are going to bring those experiences with them when they turn 18 or 19. So they'll bring those into your facilities. So it's really important to invest in ongoing training programs that are tailored specific to your staff and their specific roles and responsibilities in order to support them and make sure that they're best prepared with the most up-to-date knowledge. And so things like considering are there casino staff on your floor? Are they aware of on-site or community supports that have specific expertise in dealing with young people might be an example to consider. I wasn't sure, Jennifer, if you were reaching to unmute yourself, if you had a question.
I saw there was a couple that were sent. In addition to the recordings, are we sharing the slide deck as well? I think if you're interested in the findings, they are going to be in the report that accompanies the recording. The other one was, are these findings being shared with operators in Ontario's legal gambling market, with the AGCO, iGaming Ontario, and the Office of Ministry, Tourism, Culture and Gaming? I'm pretty sure there have been a few people on these webinars, so they will be receiving the information.
Yes. We also had a question from a post-secondary institution who just asked about how to talk with about gambling with post-secondary students. And so when we look back to sort of the call to action slide and the strategic recommendations that Jennifer provided, we would say involving your post-secondary students on your campuses in the development of any messages and program creation is really important. With our more than 20 years experience working with this target audience, we would say what we've learned is sharing the facts with them versus telling them what to do. Also avoiding scare tactics. Both of those are really good advice to follow. We would also encourage the normalization of having conversation about gambling risks and harms, and how reaching out for supports for help if you're needed is not a big deal. Remove the stigmatization, normalize those conversations. I would add, if you're an educator or you work on a campus or in a high school in health promotion, maybe start to look at how you might be able to incorporate these types of messages across or within your schools. So some concrete examples that I'll share with you is how can you collaborate with the athletics department to incorporate sports betting messaging around your home games, perhaps? Are you reaching out and working with peer educators who might be able to deliver gambling training modules to all of the students who are being hired as residence assistants? The people living in the dorms are often the ones who are hearing firsthand about issues taking place on the floors that they're responsible for. Another consideration is, are you looking to integrate gambling information across all of your health promotion work? So, for example, in substance use or financial literacy or mental health month or week, are we incorporating gambling related messages within those areas as well?
We have another question from Christina, and this one is for you, Lisa.
Oh,
do the training programs consider sharing information on illegal markets for youth, parents, and shareholders?
The training module that will be coming out really speaks to the underage market and really specifically speaking to student athletes about the impacts, the risks, the supports for teammates and friends, and then supporting their healthy decision making. Right now, we're not including information on illegal markets. We're really trying to share information so that they can focus on how do I prevent harms? How can I limit or delay my start or my start in participating in gambling, but a good thing for us to take away and contemplate for future work. So thank you.
We have another one. Education about odds and financial literacy is a good thing. Also, what is being done to educate and help youth recognize and address signs and effect of the gambling dopamine high that is often associated with gambling related harms. I would say most prevention programs do kind of talk about what it is, like those feelings. It's really trying to look at that holistic approach to understanding why there are highs, why there are lows, what it is you're talking about. So I would think that most prevention programs do address that in some way, shape, or form. Do you want to add to that?
No, I think that's okay, Jennifer.
Yeah.
Thank you. One of the submitted questions asked about who's responsible for preventing and or educating youth about gambling. Is it the individual? Is it parents? Is it government? Great question. Thank you so much for submitting that. When I look at this, I don't see it as one group who's responsible, but rather I look at it as a multi-shared approach. How are we bringing together policy, funding, harm prevention, health promotion? What about the treatment sector and public health? Are we involving research, government, those with lived and living experience? So there's a lot of people who can contribute to that work. We find here in RGC's Education and Programs Department that the communities and the schools we're working with, they can be at very different places right now. So some are at the very, just beginning to understand that underage gambling is an issue that actually needs addressing, while there's other schools who have been aware of the risks for a number of years. Some concrete examples to think about is gambling an issue that's embedded in your province's high school curriculum? Are your post-secondary institutions creating campus and community-wide committees or task forces to address the really real, unique harms to young men and women? Are you bringing together a variety of departments such as athletics, residence life? What about campus bars who serve alcohol? Student services who are responsible for student health? What about counseling? Do you know, does your schools have policies in place around allowing online gambling or sports betting in the locker rooms? How about on school buses as you're traveling away to home, away to games? Our operators, are they hiring post-secondary students to sign up other students to their online betting apps on campus? What's your school's position on teachers and coaches talking about their own gambling experiences in front of young people? There is a lot for us to consider in this space. And so we know that our young people are at very high risk for these gambling harms. And so we need to go back to our calls to action. We want to encourage people on this call today is to really look to build or foster your connections across a variety of organizations, departments, and communities, and really look for ways where you can talk about this issue and look for opportunities to work together.
Right, I agree. We do have another question. Where can youth go if they have a gambling problem? There's Kids Help Phone, which is a great resource across Canada. I do know in Ontario, Connex Ontario is a great 24/7 call helpline. They really deal with all ages and can sort of tailor resources and recommendations for where you are located. Do you have other suggestions, Lisa?
Yeah, there's actually some really great options. I'm not sure if in the moment we can copy and paste something in, but there's Connex, there's Kids Help Phone, there's Good to Talk for post-secondary students in Ontario and Nova Scotia. There's a Black Youth Helpline, there's NASIA, which helps with for Muslim youth. And there's oh, I'm going to mess up the name. There's an Indigenous helpline as well that's available. We're going to try our best to put this in the chat, and if not, we'll add it to the back of the report. But there's 6 really great youth helpline type and chat functions that's available for young people.
Great. We have another question from Joshua. I think this may have been touched on in an early slide about gambling elements in the trading cards, loot boxes. But just for clarification, did the youth gambling participation numbers include those activities as well? They did not. So the youth gambling participations were just gambling related. And then when we did the separate asking participation in video gamings, it was included in that.
One of our other questions, Jennifer, was around the conclusions from the study. What changes or priorities does the industry need to focus on?
That's a big question.
Okay.
You know, I think the biggest thing is around that normalization, and that can be easily tied back to the advertising and marketing. So I really think one of the things that, if you are in that industry side of things, really start to examine the advertising and marketing around it, and where you're placing those products, because that's ultimately adding to that normalization. But it's also those cognitive biases about how they think they can perceive their skills. So that would be my first recommendation. Did you have anything to add?
I probably would.
Okay.
When I think about sort of how harmful underage gambling is to the developing brain, there's about a 5 to 6 year gap between your brain development and then being actually legal age to gamble at 18 or 19. And so that ability to control or have more control over impulses, understand consequences, more adapted critical thinking and decision-making skills. What I would say is that across the country, I think we should be looking to the industry who financially support the organizations that can do the necessary and really important harm prevention work in our schools and on our campuses to really start to address some of these harms.
No, I completely agree. The research really is showing something's happening around that 18 to 20 years.
Mm-hmm. And then I think the last question that was submitted is just looking for ways to, what can we do around the introduction of youth to gambling? So I think that the question is really asking about that those gambling-like elements or mechanics that are within loot boxes and things like that. What are our ideas for solutions around education, regulation, and sort of work with parents and guardians? And so I think for me, I'd look at it from really from an education and a program perspective. And so the development of initiatives that can be put into schools tailored to reach different audiences would be key. What kind of additional resources, what kind of campaigns can we do to help support the learning and the understanding for our parents, those or caregivers and those people in positions of authority? So really focusing, I think, on increasing their understanding and knowledge about what are the signs to look for in young people. Can you recognize what those risks are that are associated with underage gambling? Do you know about how to learn how to set screen limits with your children? Do you know how to effectively communicate with your child about their digital well-being and having those conversations? You know, we want parents to feel comfortable about having the tech talk with their kids, you know, setting screen hygiene rules like no screens in the bedroom or no screens after a certain time of night. The other part is about modeling healthy screen behaviors themselves. So really, I look at this as sort of ongoing collaborative work between educators, community groups, public health, youth and young people. And then, of course, all of that with current research to help inform these prevention and educational efforts and policies out there.
Yeah, I was just going to add, I think from the research perspective, just really continuing to do research that looks at these relationships between the two is important.
So that was all the questions that I had come in, Jennifer.
Yeah, me too.
Okay, so
let me switch over. There.
Good questions, everybody. Thank you so much. We really appreciate you joining us today. We appreciate all your good questions that have come in. We do have an evaluation screen with with a QR code, on the screen. We'd love to hear your thoughts about the webinar and the information that we did share with you today. We have included both Jennifer and my information on the screen, so please feel free to reach out to either of us with any questions, and we'd be happy to do so. And just as a reminder, we will be circulating a link to the recording from the session today, along with the report for you to use that has these key research findings and strategic recommendations, along with some, we'll include some of the questions and answers we got today, so that you can have that as well. So thank you all for making time for joining us today, and we do look forward to hearing from you. So thank you.